My name is Jerry Hesch, and I am here at Carrington College in Mesa, Arizona. This is the last weekend in April 2014. And this is the seminar brochure. And the seminar title is called Hesch Institute Presents Integrating Function in the Pelvis, Sacroiliac, Symphysis Pubis, Hip and Lumbar Spine. And Sandy volunteered to let us screen her structure. And we found that she has this pattern named posterior glide fixation of the sacrum with bilateral inflare. She's going to describe this pattern. This pattern is not described in the literature. It's one that I stumbled on some years ago, and it seems that every time I go teach, I find at least one person in the audience that has it. And it's a very interesting pattern. We're going to film later on when I screen her briefly again and when we treat her, and we will film her response to treatment. So Sandy's going to tell her story. Thank you.
Some years ago, I would say 12 to 13 years ago, I was working in the hospital and trying to get a patient out of a bed that was elevated at the foot end, so reaching under to release the bed, and then felt my back lock up, and at that time I didn't know what had happened, but a course of muscle relaxers and exercise started to feel better. It's probably been about 5 years ago I had another sort of slip and fall down to my right knee, left leg forward, and those are the only two injuries I can think of. But in the years since these injuries, I've had increasing pain and decreasing movement, especially on the right side. Right hip feels limited, pain at all times. That I guess we would perceive as in the hip, and then limited pelvic motion. So in my screen, Jerry found a posterior glide of the sacrum, and I'm really hopeful that this afternoon he'll be able to help me fix that.
And can you also elaborate? We did find some restriction in the right hip, and I mentioned that I thought you had some hip pathology, and you responded.
The hip has been checked several times through orthopedic studies, x-rays, and I have been seen by several physical therapists, and we just can't find any real pathology in the hip to date. So. And
it's been 13 years?
Since the original injury.
How does it impact your life now?
I don't like to sit. I don't sit much. I do exercise. I have pain at all times. It affects my sleep. I wake from sleep. I do have nerve pain down the leg. That can wake me. Pain into the right foot. Definitely always buttock pain, hip pain. Mostly always on the right. And I definitely feel better with exercise, but the pain never goes away. I do also suffer with, headaches, and all that was just part of my history with cervical headache. Right side.
And who are all the type of clinicians you've seen for this?
I've seen an orthopedic surgeon, 2 different orthopedic surgeons, several physical therapists. I did even have a workup with a urologist for urinary frequency. Trying to think of all the tests I've had, but I've seen a neurologist for the headaches that were determined to be cervical and cluster headaches. So.
And in your own interpretation of this injury, what do you feel that it is?
I always felt it was instability on the right. Instability in the right SI, right hip, is what it feels like to me.
And you've had difficulty getting, finding a practitioner that was able to make a difference, or some benefit? What was that?
We didn't really ever find anything that benefited. I just feel better with exercise, and that's always been the recommendation. Work on your core muscles, continue to strengthen hip muscles, and stretch. And that's just been general recommendations that have not really helped.
And so you did elaborate about how this does impact your life somewhat. So if this were significantly better, how do you think your life would be better?
Well, just from a pain perspective, I would enjoy sleeping through the night. And I did mention that urinary frequency. That would be great to not have to deal with that. I do enjoy, and I mentioned martial arts, kickboxing, which has severely impacted my range of motion in the right hip. So I'm hoping that would be greatly improved. I could definitely see my balance improving. I tend to always be left leg dominant because I don't trust the right leg in any balance exercise. I definitely feel weaker on the right, so I'm hoping that would be improved.
So it would be interesting to see what we unravel, because you're atypical in terms of people that I see with the posterior sacral glide pattern. The pain down the leg is not a typical attribute of that. And then the limited motion in the hip up above 90 degrees. I talked about between 11 o'clock and 2 o'clock or so. Up there, it just doesn't feel as smooth as on the other side. And I know that you're very tender anteriorly on the anterior inguinal area all the way to the pubic structure. So it might be a process of unfolding and perhaps seeing several things going on as opposed to just a posterior glide of the sacrum and bilateral inflare. But let's go ahead and keep on filming, and let's have you lay on the table, and I can demonstrate the focused screen on the hip and on the pelvis. Yeah, let's just lie with your head up there, please.
Who's on the other
Head up there, please. In fact, this is a better table. Let's get you on this table because it's much firmer. So it's almost 1 o'clock, so I'm going to speed it up a little bit because we are at a workshop. And I don't know where are they all congregating in the other room perhaps?
Yeah, I think
Okay. All right. Do you want to tell them I'll be there in 5 minutes, please?
Okay.
Thanks. No, you're fine. You're fine. So I just want to demonstrate very quickly. I think this is a very important pattern. I think it's important that we gather more data on this pattern because it's not in our body of literature. I cannot take up the slack through the pelvis. It feels like I'm pushing on a block of granite. I'm going to test side glide mobility. No give. Inferior glide mobility. No give whatsoever, and I know you're very tender there. Okay. The right hip has a little bit less movement with a scour test. And I'm aware of some of the literature on that, but we're not going to debate it for our purposes here. I find some value with that test. And with that. It actually seems to move a little smoother than yesterday, so who knows? You know, there could be some little variation throughout the day. And this one does not provoke pain. Okay. Let's have you stay on your back as you are. What we find with the posterior glide of the sacrum is that there's a restriction with springing of the sternal body, upper body of the sternum. And you can see that this force goes through your body. And when I get right here, with the same amount of force, I cannot create movement. Can you feel that? Okay. And also the rib has restricted mobility. That's rib number 4, whereas rib number 5 below has mobility. Rib number 3 above that has mobility. Could you line your stomach, please? The sacrotuberous ligaments are, right here is your right, and I cannot indent it. It feels like bone, but there's no bone right in that area. So these ligaments are very, very tight. Sacrospinous is going to be up here. That feels very, very hard. Here is a midline sacral thrust. No mobility. Here's a anterior rotation spring on the ilium, no movement. Here's inferior. Here's superior glide, just no mobility. Here is a PA at L5, cannot induce motion with a reasonable normative amount of force. L4 does spring. The rest of her body has good mobility. If you would line your back, please. What we find with this pattern is that the body compensates with hyperextension at about T3-4, therefore you lose that spring mobility up here, but the body also hyperextends in the upper cervical. I can feel the tubercle of C1 quickly. There isn't the normative sulcus. If I try and glide C1 left, it doesn't move. If I try and glide it to the right, it does not move freely. If I spring on the mastoid on the right and on the left with a normal amount of force, there's no movement. If I try to lift up your head, isolating the OA joint, no movement. I can go below that and I can get movement at C2, C3. If I come under the occiput onto C1, no movement. If I come to 2, see the free movement at 2, and then 3, 4, on down. So I think that we'll know more once we start the process of treatment. There could be some things occulted right now that we're not picking up on. So we will start treatment later on, and we will come film your response to treatment. Thanks very much.
Thank you.
Thanks.